Good afternoon, everybody, and welcome to Prevention Works Live, our exciting new series of webinars and podcasts with some of Australia's leaders in public health, who will be talking to you about their research and about creating change for the prevention of chronic disease. I'd like to begin today's session by acknowledging the traditional custodians of the land on which I sit, the Gadigal people of the Eora Nation. I also acknowledge the traditional custodians of the various lands from which you may be joining this event, and pay my respect to elders past, present and emerging. I also acknowledge all Aboriginal and Torres Strait Islander people joining this event. My name's Lucy Ryde-Chetnik, and I'm the co-director of the Australian Prevention Partnership Centre, a role that I'm honoured to share with my fellow professor and co-director, Andrew Wilson. And I realise that some of you listening today may not be familiar with the work of the Prevention Centre, so I'll just say a few words about who we are and what we do before I introduce today's special guest. The Prevention Centre is a national partnership which includes researchers, policymakers and practitioners, and we work together to find innovative solutions to prevent Australia's growing burden of chronic disease. And of course, by chronic disease, we mean conditions that cause ongoing illness, disability and sometimes early death, so conditions like diabetes, heart disease, cancer or poor mental health. And I know many of you know that by around middle age, half of Australians suffer from at least one chronic disease, and many have two or more. And by the end of our lives, nearly 90% of deaths can be attributed to chronic disease. So the work of the Prevention Centre supports research, research translation, science communication, building the next generation of prevention leaders, and supporting evidence-informed prevention policy and practice. And I'd just like to acknowledge our funding partners, because some of the work that we do doesn't always fit within traditional research funding schemes. So the Prevention Centre's programme of work is supported through an innovative pooled funding model with contributions from 8 partner agencies. So we have contributions from the National Health and Medical Research Council, the Commonwealth Department of Health, New South Wales, ACT and Tasmanian Departments of Health, Wellbeing SA, Cancer Council and Vic Health. And it's administered by the Sachs Institute. This novel collaborative approach allows our partners to jointly invest in shared research priorities and together support some truly innovative applied research with huge potential for potential population-wide benefits. As you'll hear today, it's important that we implement chronic disease prevention in the settings in which people live, travel and work. Innovative solutions that can be implemented at scale can support the health and well-being of individuals, local communities and whole populations. And it's important to take an evidence-based approach to such large-scale investments. And the return on investment can be enormous if we get it right. So Prevention Works Live, this webinar series, aims to provide opportunities for you to hear directly from some of Australia's leading prevention innovators who've been successful in translating their research to support real change. We'll be talking to our guests about how their work has had impacts on public policy, health promoting practices, and ultimately on people's lives. We want these sessions to provide a window into some of the behind the scenes thinking, the challenges and the solutions that our speakers have adopted, things that you don't usually see in a scientific paper or a conference presentation. So the format for today will include a presentation by our guest speaker, followed by a conversation that will be guided by questions from me and another colleague, to which you, our lovely audience, are also invited to contribute your own questions. So today we are absolutely delighted to welcome to Prevention Works Live our wonderful friend and colleague, distinguished Professor Billie Giles-Corti. Billie is a Vice-Chancellor's Professorial Fellow at RMIT University and Director of the Healthy Livable Cities Research Group within the RMIT Centre for Urban Research. I would confidently describe Billie as one of the most influential and impactful health researchers in Australia today. Her work is internationally recognised and she's been ranked globally in the top 1% of her field. But Billie is a change maker not only because of the innovative nature of her work, but also due to the way her research has engaged and influenced important sectors that sit outside of health, sectors like planning and transport, that also have enormous influence on all of our health and well-being. As we know, many of the things that determine health are not controlled by the health system. Things like healthy and affordable food, clean water, fresh air, and outdoor spaces. It also includes things like our commutes to work, the type of work we do, and whether we have any work at all. Billie heads up a world-leading program of research examining what it takes to make our cities and communities more livable and healthy. Her team have developed and tested the first set of national policy-relevant measures of livability, which now offer practical ways for policymakers to assess, monitor, and compare the livability of our cities around Australia. Measuring and comparing these complex factors are important steps for creating change, but as we will hear, it takes a lot more than that. But before I hand over to Billie to talk about her work, I'd also just like to introduce Melody Ding, who will be joining us for the question and answer session after Billie's presentation. Melody is an associate professor in the School of Public Health at the University of Sydney, where she researches the complex relationships between physical activity, chronic disease, and the environments that support or hinder a physically active lifestyle. Melody is also a great admirer of Billie's work, and she'll join us for the conversation to ask some of the questions that I'm sure many of you will also want to know. During the Q&A session, you'll be able to contribute questions by clicking on the blue hand icon, which is in the top right corner of your screen, and we'll try and incorporate as many of those as possible into our conversation. And as Billie is speaking, you'll also be able to change the size of the slides as you see them on your screen by scrolling over the slides and selecting the full text format. So with that introduction, I'd really like to welcome and hand over to you, Billie. We're really excited and looking forward to hearing your talk.
Thank you so much, Lucy. It's such a lovely introduction and so generous, and it's really appreciated. I'm really honoured to have this opportunity to do some reflections, and I've called my talk "The Journey of a," because it's called Change Makers. The focus of this series is on change makers, the journey of a change maker, but lessons looking back, because some of this has been less planned than it's actually turned out to be. But it's interesting even for me to look back and see what a research program can achieve and to try and distill why that's happened. So my work on livability started when I first moved to Melbourne, and our group has been instrumental in trying to, everyone talks about livability, it's really important, but what we decided to do is to define it. And so we've defined livability as something that is safe and socially cohesive and inclusive. It's environmentally sustainable, it's got affordable and diverse housing, but it's no point providing affordable housing if it's not linked by walking, cycling and public transport infrastructure to employment, to education, public open space, local shops, all the things we need for local living. So that was our definition of livability. We've had a lot of impact with our research, and this has started since I've moved to Melbourne in 2011. I was invited with a colleague, from the health department, to write the health and wellbeing sections of the state government's Plan Melbourne by the Ministerial Council, the MAC, the Ministerial Advisory Council. So I went on to that, and you can see the title of the theme that I was involved in was the Livable Communities and Neighbourhoods, and I really liked Direction 4, which was about what they wanted to do was to create environments that were safe and encourage healthy lifestyles. So that was a great honour. I must admit, though, for those of you researchers, what I wrote didn't end up in the policy. We wrote the framework, but our policymakers wrote it into policy speak. It's a very different language, but nevertheless, the principles of what we were trying to get across came across beautifully. I couldn't have asked to be done it any better. The next exciting thing for us was that our definition of livability was adopted by the Victorian Public Health and Wellbeing Plan. So this is the 2015 and 2019 plan. It's now also included in the next plan. So the current plan has got our definition of livability. And that's important because in Victoria, local government looks to the state government policy to write its municipal health plans. Every 4 years after each round of elections for local government, they need to write municipal health and wellbeing plans. This is a requirement of the Act. And they look to the health and wellbeing plan of the state government to come up with their plans. And so we've had a lot of a policy impact because we've had our concept of livability and our measures of livability included in many of the local government plans. So here's Cardinia, Moreland, the interface councils, which is on the peri-urban fringe of the city, Mornington Peninsula. Many councils have picked up our livability work and our indicators. I'm really excited to say that we've also had impact at the federal government level. So this is the National Cities Performance Framework for cities, and some of our indicators of livability, 4 of our indicators of livability have turned up in the federal, not turned up, they have been included in. They didn't turn up. We actually helped create this, but they're included, and here we've got an acknowledgement here. So they're in the performance framework, and they wouldn't have had these sorts of measures had we not been doing our research and been advocating for it. Going back to the state government, I'm really very excited to say that we have in Melbourne the 20-minute neighbourhood. In Sydney, it's a 30-minute neighbourhood city, but we have the 20-minute neighbourhood, and our work on livability has been picked up in this report. Many of our metrics for how we could create 20-minute neighbourhoods from our research program have been translated into the 20-minute neighbourhood concept, the 800-metre buffer, the access to shops and services, the 25 dwellings per hectare came from our research. And what's important also is that our livability work is, referenced here. So the state government has recommended to itself that they adopt our recommendations from our report, which is a TAPS-funded research actually. In 2017, we published this report, and they've started to talk about in this document about what we've proposed and recommending to itself that they should follow it. So I guess what I wanted to do in presenting that was not to guide about how great we've been, but really just to tell you, how did this happen? That's a lot of impact for, a 5 or 8-year program of work, I think, in terms of changing policy at local, state and federal level. How did this happen? And that's what my story is going to be about, is how did we make this happen? Well, first of all, it happened because we had an experience of this. I've done this in Perth, so that I'm bringing on evidence of experience from my experience in Perth, and that was included. We evaluated in Western Australia the Livable Neighbourhood Guidelines, but I wanted to bring here, the lessons looking back. It was not necessarily all well planned, but it's certainly been it's great lessons that come from this. Now, at the top of each of my slides, you'll see these red headings with a cross next to it, and that is the lesson. So if you're jotting down notes, you'll get the slides afterwards. But this is the first lesson in life for me about how you get change. The first thing is about how we have partnerships with policymakers and practitioners. I'd like to introduce to you Dr. Ian Butterworth. He's a pracademic. He was working at the time when I was coming to Melbourne in 2011 in the state government, in the Department of Health, and he was involved in the Northwest region. And the University of Melbourne, where I went to work, had a relationship with this group, with this region, and he contacted me before I came. So here we are. I'm sorry about the cut-off here, but we're going to now show you the video from Ian Butterworth. And I asked him the question, what sort of evidence do you need to create a more supportive environment?
We need conclusive evidence that shows the relationship between good urban planning and making it easy for people to experience exercise as part of their everyday lives. Not just exercise, but also access to good places, access to healthy food, access to great public transport that's reliable, affordable, frequent, integrated with other forms of transport. We need to make sure that people have got good access to local parks, fresh food outlets, entertainment, leisure, friends and family, or at least transportation options to get there. That information needs to be taken up not only by health people, but in particular by developers and by people that manage urban planning portfolios. Ultimately, we want to influence the policy and legislative environment that makes it imperative for any urban development proposal to show that it links into best practice and the evidence base to support that.
So you can see from what Ian was saying to me, this is a pretty big agenda. So no pressure. This is like the first when I first arrived in Melbourne, and it was a big agenda, an exciting agenda. And that's when we started to think about this concept of reframing the social determinants of health. Because when I went and did those interviews out in the suburban areas and talked to people about what was going to promote health, it was clear that these were really the upstream determinants of health, the causes of the causes, the social determinants of health. But I can tell when I went to talk to the Secretary of Transport, if I talk to the Secretary of Transport about the social determinants of health, I can tell in a heartbeat that they would just glaze over. They would not be interested in that concept. But if I talk to them about livability, they really got excited. And Melbourne, as you know, has been ranked many times by the Economist Intelligence Unit as one of the most livable cities in the world. We get very excited about that concept. We've been pipped at the post now by Vienna. But we did have this concept of livability in Melbourne that was very popular. And so what we did was we free-framed the whole concept of livability in the social determinants of health in the concept of livability. Now, it's really important in thinking about this is second lesson in life. So first, work with policymakers, come up with concepts that were relevant to them. And then the second part was to understand the policy world you're trying to influence. I realized, especially coming to Melbourne from Perth, that we really needed to have, I needed to understand the policy environment. So we had a student, Melanie Lowe, who looked at integrated planning for healthy communities and looked at state government policy in Victoria. So that was really useful, and that was a great piece of work. And then I also had another student, Jeff Brown. He looked at local government strategic planning and for health and wellbeing, and was looking at the same thing at the local government area level. And then we did a national study, and then this was building on the work we'd done in Perth on the Livable Neighbourhood Guidelines, particularly work done by Paula Hooper. But in our national livability study, what we did was we looked at the policies that were designed to create livable cities to see whether or not we were actually creating livable cities or whether we had the policy frameworks in place. And we also mapped those policies to see whether or not they were being delivered. And that was a really powerful thing. But understanding the policy world was really important. It's really important to also undertake policy relevant studies. And that was another lesson that we learned. This is really critical. This paper was really influential to me. It was a paper by Steve Allender published in 2009. And tell us something we don't already know or do. And this was the response of the planning and transport professionals when they presented to them the public health guidance about how to create built environments that support physical activity. So saying to a transport planner, create a walkable environment and it will encourage people to walk is really not that useful. And that's what they were saying. Tell us something that we don't already know or do. Tell us how to do that was something that was the message I got out of the paper. These people were benevolent about health people being involved in this sort of work, because what they said was it's great to have planning and transport people. This was a study done in the UK, by the way. So they said it's great that plan health, it's really important for health to get involved in this agenda, but just don't tell us something that we already know and do. So really important, and that really stuck in my mind about how we should do our work. Now, this is I hope you can see this, but I just wanted to show at a high level what I mean by that. So, for example, in our National Livability Report, the one I just showed you, for example, it has, in Melbourne, there are policies. What percentage of addresses should be within 1 kilometre of an activity centre with a supermarket? The policy target, which is in the second column, the third column there, is that there should 80 to 9% of households should live within a kilometre of a activity centre with a supermarket. The reality is the next one, we actually measured that. We looked at how many people, how many residential addresses are within a kilometre. We found that it was only 39.78, less than 40%, even though the target is 80 to 90%, only 40% were actually achieving the target. And if you look over to the final column, only 11% of suburbs had houses, were actually meeting the target, actually had all their addresses, 80 to 90% of their addresses meeting the target. Now, this was actually really powerful research. It was very policy relevant. The policymakers were extremely interested in it. And now we've done that nationally. If you can imagine that, we've done that for every residential parcel in 21 cities in Australia. It's a very exciting study. We also mapped it, which was even more powerful, because what we showed, well, this was the target around density. Density is really critical. If you want to have a walkable neighbourhood, if we want to have walkable cities, building house at 15 dwellings per hectare, which actually is a lot of the policies in our state governments, we still have targets of 15 dwellings per hectare, but even then it's not being achieved. What's really interesting, so here we have, if you look in the dark pink, in each of the cities. You can see where they're actually, it's 15 dwellings per hectare, up to 15 to 26, but very low density. And in this, and below, what we showed was the suburbs where it was achieving that target of 15 dwellings per hectare. And you can see it's only really in the inner cities, hardly any in any of these cities, Sydney being the most dense. Again, this attracted policymakers. They were very interested because even though the policies were not high enough from our point of view, they needed to be up to about 25 dwellings per hectare to create walkable neighbourhoods. We had this evidence to show them they weren't doing so well. What I'm really proud about actually in this sort of work is that the Minister for Planning was talking to developers in Victoria, and he said to them, have you seen this report from RMIT? We are not doing very well. We're doing badly. We're actually creating ghettos in these communities. We really need to do something better. So again, it's what that to me is a sign of success. We really wrote that report very carefully, and we were really fortunate to be working with TAPS because they helped us to write the report card of how our cities were doing. They helped us distill the key messages, and they helped us present the recommendations in a really user-friendly way. And what, again, really excites me is this idea that you make sense of the evidence for people. So if we want to influence policy, we need to make sense of the evidence. And the way we did that was we're creating this like report card, which was in a very user-friendly way of distilling everything we'd found. And what was great was with the recommendations, I was really excited. There was a guy at the colleague of one of our group members from the Planning Institute of Australia, and he said he cut out these recommendations and had them on the front of his desk, and that would just tell him what they needed to be working on. Now, very dorky of me to be excited about that, but that was really exciting to me that people wanted to do that. So to actually take this a step further, the other lesson, influencing policy and making sense of the evidence, we actually did scorecards for each of the Australian cities where we'd done policy analysis to report back to them in a very user-friendly way what we were finding for each of those cities, because each city is interested in themselves. They might want to benchmark against another, but we put report cards, and now we have report cards actually for the 21 cities that are in our Australian Urban Observatory, which I'll present to you in a minute. Now, you might say, if you're a researcher, oh gosh, this is really policy relevant, it's not going to be very exciting, but I think that's the other lesson. If you want to do this work, create an exciting scientific enterprise. I mean, I think we've published a lot of papers in this area. This was work led by Hannah Badland. She did a brilliant job of looking at, what we wanted to say was all the indicators that have gone into our national study have been all policy relevant ones, but they've also been tested out to see whether they promote health and well-being. So we created a whole bunch of papers which have had a lot of impact from a scientific point of view. We published papers looking at their relationship with health and well-being outcomes. And so I don't think that doing policy relevant research excludes you from having an exciting scientific enterprise. Now, it's all very well to have all that evidence, but again, if we want people to use the evidence, we need to make it really relevant for people. So what we did at the end of all of that work, a big body of work, over 8 years, we published our metrics of how to create a healthy, livable city, our urban livability checklist, which was really designed for planners to use. So when they were assessing a structure plan, they could say, well, what's the ideal and what is this development trying to achieve? So it was really a tool that they could use in their assessing structure plans, so they can actually see where the gaps were. And we based it on all about the evidence that we'd accumulated over 8 years. Now, we didn't stop there. We really wanted people to use this evidence. So we had a huge database of geospatial data. We had it for 21 cities, or we created it for 21 cities thanks to the help from TAPS, the funding from TAPS. So we have indicators of that create a livable city for 21 cities that are in the National Performance Framework for the federal government, and we put it into the Australian Urban Observatory. And the whole idea of this was to harness all this complex data to help people plan for the future. And also, if it's repeated over time, which will require funding, it would then allow people to benchmark and monitor over time. So, we always had the end in mind. We wanted to change the world, and that's what we tried to do. Now, we haven't stopped there. We think the other part to this is that we need to take it even further than this. We responded to call for submissions. There's often calls for submissions asking for evidence around a topic. And the one that we responded to, which we had a lot of coverage in, if you look at the report, we mentioned quite a lot, is the building up and moving out report that came out. It was the federal government looking at the federal government's role in cities. And so we've been included, we put a submission in there. We also put a submission, the middle one is around the federal government when it was doing its performance framework. One of the reasons why we got a lot of our indicators up in the performance framework, we put in a submission and we said we could provide these for you. And as a result of that, with some letter writing, we managed to get our indicators in. We've just put one in recently. The one on the right is for Infrastructure Victoria. So doing that is important. The other thing which is a big tip I think is important is to work with external advocates. You can't do all this work by yourself. You need people who are going to amplify your work. So we worked with the Heart Foundation. So on the left, this is the Healthy Active by Design. We wrote all the policy briefs for it, all the evidence reviews that have gone into their website. And we also work with the Planning Institute of Australia, and they've helped to amplify. So when we have findings, they've actually amplified a lot of our findings. And I think what's really critical is that we need to be alert to the broader policy environment. I think we have a climate emergency. So the way we plan cities contributes to that in terms of emissions, in terms of the heat island effects that's going to be created if we don't have enough urban greening. This is a big agenda. And I think if you want to make your research really relevant, it needs to be alert to these broader agendas and to pivot, as the current word is, to be able to incorporate those ideas. So I just wanted to recap on what are the lessons looking back and to go through these again. First of all, we need to have partnerships with policymakers and practitioners. This is really critical, and you can see the value of that in a relatively short time through Ian Butterworth. And for you, if you're a policymaker or a practitioner, you can facilitate researchers getting established as Ian Butterworth did. I have to thank him. I can't thank him enough for those. It was inconvenient, but it was such a fantastic thing that he did, introducing me to people in Melbourne by me getting to interview them for him. You need to have policy relevant studies. We need to, if you want to change the world, you have to do policy relevant studies. You can create a dynamic, high quality scientific enterprise by doing research that's really relevant. We need to understand the policy world that we're trying to influence, so doing that policy analysis. But it's no point just trying to influence policy if you don't take your evidence and then make sense of it for a policymaker. So writing policy briefs, and trying to summarise it in a very user-friendly way. Responding to calls for submissions is one way of getting your evidence out there, working with advocates, and then being alert to broader policy issues. I've added in a couple of other little tips, the last few things here. I think it's really important that if we're doing research, so what you need to do is find a topic that you're completely fascinated by, but also focus on what's important. And sometimes it just requires, by working with policymakers, you can see what fascinates you, but turn it 5 degrees to the right or left, and then it can really be relevant to them. I think it's really important that you collaborate with people you respect and who respect you. So working with people is really critical, but you need to work with people who respect you, but that you respect as well. And I think it's really critical to look after yourself, because it really is a very demanding, being a researcher is very demanding, and it does require us to look after ourselves to make sure that we're healthy doing this. And finally, if there's any funders on board on this call, I hope you are, I want you to know this takes time and it must be resourced within the research funding envelope. No one else is going to fund it. I've been really fortunate to have had funding from TAPS. It's been a real pleasure and privilege to me to work with them. They've facilitated, they've helped amplify, they've helped us to communicate the results, but also they've actually funded things, as Lucy said, that wouldn't normally perhaps be funded. To actually do the observatory, we wouldn't have been able to do that had we not had support from TAPS and other funders. And of course, it's not possible without a huge team. We've had a brilliant group of people who have worked on this over the years. Ian Butterworth is the person sitting next to me there in the image, really helped me this all get established. But there are lots of people. Hannah led the work in terms of our testing out the indicators to see which ones we should have in our livability index. Melanie Davin's now leading the Australian Urban Observatory, and a whole bunch of people have contributed in so many ways. I just want to acknowledge the Heart Foundation for its work. I want to acknowledge the NHMRC for funding the Healthy Livable Cities group. Of course, the SACS Institute, or through the Strain Prevention Partnership Centre, for the funding that we've got from TAPS, and then also Clean Air and Urban Landscape. Because to do work like this, which was very big idea, a lot of inputs, required a very big program of work. And I'm going to finish there, and I hope you found that interesting. Thank you.
Wonderful. Billie, can you hear me?
I can.
Great. And I just want to check with Jason. Can the audience also hear me?
Yes, they can.
Great. Thank you so much. Thank you so much, Billie. I can hear the enthusiasm and the passion in your presentation. And it's really inspiring, the amount of work that you've achieved and the huge impacts that you've had. I just wanted to say to the audience, Billie mentioned TAPS a few times. So some of you are not familiar with our little acronym. That's the Australian Prevention Partnership Centre. So thank you, Billie, for the call out there. We sometimes refer to us also as the Prevention Centre. So just so that you know what Billie was talking about. And I did have a question for you, Billie, because I know that everyone is needing to focus on impact and creating change now. You know, it's a requirement when you're applying for funding, is to demonstrate how we've had an impact. But that's relatively recent, and you've obviously been doing this for a long time, and you've been having the focus on creating change and having an impact for a long time. So I just wondered if you could tell us a bit about why you even came with that focus. What made you start thinking about your research in that way? I mean, you could have just developed these indicators and published them and done a conference presentation, and that would have been it. So what was the driver that made you really think about that you wanted to make sure that these things were actually being implemented and having an impact on our lives?
I think that came from where I very first started my PhD. Like when I was doing my PhD, I developed a new area of research. I was one of the first people to do work on the built environment and health, and I had no idea how to tackle that. I wanted to do it because the Ottawa Charter had been published by WHO, World Health Organization, in 1986, and it talked about healthy public policy and supportive environments. And I got really excited because there wasn't much evidence about that. It seemed like a really good idea for a PhD topic. I wanted to focus on physical activity. I didn't know about all the sort of determinants of that would be the environmental determinants that would create the healthy public policy or the supportive environment. So I had to go and talk to a lot of people. And I guess so during my PhD, my starting point, I did two things, which was really important. I did qualitative research with the community, the wisdom of crowds. I mean, if you ask the public, and the question I put to them through my PhD supervisor, Rob Donovan, who was a really talented social marketing guru, and he helped me with the focus groups. If you were a developer designing a community to make people healthy and to be physically active, what would you put in it? All the things I talk about are exactly what the public would say to do. So it's not rocket science. It's hard to implement, but it's not rocket science. So talking to the community, wisdom of crowds, they know what to do. And the other part was that I talked a lot to policymakers, because I went around to people to ask them what they thought about my idea, because it was a bit out there. Some people have admitted to me that they thought I was a bit nutty actually tackling this topic. They thought it was a bit of a crazy idea, that my career wasn't going to go too far by doing this. It was like a career limiting decision to go into this area because it seemed a bit odd. But I talked to a lot of people, and they gave me a lot of insights about cities and planning. So it's really come from a need. There's nothing the mother of invention. Necessity. And so really trying to understand something, I had to read across a lot of literatures, and also because I didn't finish my PhD till I was 42. So I don't want to do anything that's not going to make a difference, because I wasn't going to have a very long career as an academic. So I wanted to make sure that I had an impact, because it wasn't going to be very long, and I wanted to focus on something that that made me excited, that lit my boat, but also at the same time was important. And so that's really why I've always worked with policymakers. I've got people that I've worked with for 30 years now, and they are such good mentors. I've learned so much from policymakers and practitioners who I really admire. And I think part of the thing here in Melbourne, I have coffees with people. I catch up with them a lot. to find out what the story is, to find out what's going on, and also to sort of to help shape our work so it becomes really relevant to them. And I hear from them about what the current agendas are. So it's really, really helpful, because sometimes you don't need to change your research dramatically. You can actually just shift it 5 or 10 degrees either way, and it makes all the difference.
That's wonderful. Thanks, Billie. Melody, I might bring you in here because I'm sure you've got many questions as well. So we'll take it in turns. Won't be too greedy. So I'll hand over to you.
Hi, Billie. Really enjoy your presentation. I feel like I can grill you here for a whole day, because I myself is going through this transition from early career researcher to mid-career researcher. So I think my questions will at times be quite career development focused. So it's really, really inspiring to see what you have achieved, your program of research in terms of impact. And it's really interesting to see you going back in time and sharing these lessons with us. And just now, when you're responding to Lucy's question, you talked about your PhD as well. I guess my question, naturally building on to that, is how do you know if we now drop the Billie today back to, say, 5 years postdoctoral, looking at these things prospectively, not retrospectively, how do you know that you're on the right track in terms of, because we're all going through this challenge as a researcher. We need to develop a niche, we need to develop a program of research that will be sustainable. And you have also mentioned that, sometimes we think it's really important, but if we turn our eyes 5 degrees to the left and right, it might not matter that much to the grand scheme of things. Could you touch a little bit on that? Especially when you're going through challenging times, how do you know that you're on the right track?
It's a really good question, and I think it's a really hard question. It's hard to know you're on the right track. I mean, I think the trouble now is everyone's focused on high impact. They're focused on, career development. And to be honest, I never really worried about any of that stuff. I didn't think about it. To be honest, when I finished my PhD, I had one qualitative paper. And it was published in the Health Promotion Journal of Australia. I love the Health Promotion Journal of Australia, but it's not the highest impact paper in the world, So I didn't even know about any of that sort of thing. And when immediately after I finished my PhD, I went down and established a campus for UWA down on the south coast of Western Australia, and didn't publish any of the papers from my PhD for about another 4 years. So I finished my PhD in 98, and I didn't publish any papers until 2002. So, that I've got a pretty odd career directory, but it was a cutting edge idea. And and I didn't know that it was going to be successful. And as I said, that people told me they thought I was a bit crazy pursuing this. It was a bit of a career limiting idea. What was really important was I had some, I think when you're doing a PhD, you know some good ideas. So I came up with some good ideas during my PhD about the next studies that I could be doing. I think it's a really good idea to be thinking about what could you do with your PhD that could be a grant idea. And I was smart enough to know that I wasn't going to be able to get grants without senior people on my team. And I was really fortunate that I had really senior people who actually came on my grants, and they were so important because they helped me, whip me into shape, if you like. And it's one thing knowing about writing a PhD; it's another thing about knowing how to be a successful grantsman. So they really were helpful. And I remember at the time I got interviewed by NHMRC, and we were for our grant, and I was Matt Newman and Conrad Jemrozik, who's no longer with us, but they both walked in, and I was little Billie in the middle, and here are these two tall guys, and we walked in and we got interviewed by NHMRC, which was absolutely terrifying. They'd been through it many times before. So they really helped me enormously. Now, when senior people like that tell you that you've got a good idea, and they help you develop that good idea, and I have never been, I think my ego has been well checked. I never really thought I'm fantastic. I've always doubted myself. And so as a result of that, I was able to listen to their critique and not be offended by it. So when someone edited my work, my PhD supervisor edited my work, I never was offended by that because I never thought I was that great anyway. So, it was actually really important to take advice and not be offended. You actually just see it's the focus on the work. Now, in terms of an important idea, the way I had the important idea, well, I didn't know it was going to be important, and I didn't know it was going to have this much impact. But I think the fact that it was and my supervisors helped me with my topic, of course, but the fact that the NHM, the World Health Organization, put out this new document. The Ottawa Charter had just come out in '86. I started my PhD in '92. I did it part time. My PhD took until 2008, but it come out. So that was cutting edge because there wasn't much evidence around about it. And then I suppose, and to be honest, I've really just followed my nose because I really want to do what I was passionate about. I feel like I've been very fortunate. I mean, I just get excited about the topic, but I've also listened. I think listening is really important. Listening to the policymakers that I've worked with, when they think it's a really dumb idea or they think it's a really good idea, or I can see the problems that they're struggling with, and I think I want them I don't want to do what Steve Allen just said, tell them something that they're already doing. I wanted to help them, add value to help them do it. So, for example, we've been focusing on thresholds. How much of an intervention do you need that would promote health and well-being? Now, we know that a walkable community is right, but what does that actually mean in practice? What densities, what's levels of mixture, and also would there be unintended consequences? How do you, ameliorate those problems? So really, I guess it's the partnership. So it's not easy to know that you're going to have impact. I mean, I didn't start off thinking I'm going to have impact. I think that's why you're in the unfortunate position where you're thinking about how can I create impact, because that's what's required of us. And I think it's so unfair. I think what it is trying to have good quality in the areas of in applied research. It's high quality, of course, it's essential, innovative, new methods, and relevant to the people that you're trying to influence, and working with a team of people around you that can actually add value. I don't know if that's a good answer to the question, because I think it's a different world that you're in now, because everyone focuses on metrics. When I was starting out, you can see I had a paper in the Health Promotion Journal of Australia. It was my first publication out of my PhD. My students don't ever do that now, of course. But it was a different world, when I finished my PhD 22 years ago than it is now, and you're under a lot more pressure. I think what is really important to do is to actually just work also with a team, because one of the things that you come from working in a team is that you're not trying to do it by yourself. Collaboration is the big answer to a successful career. I think it's really important.
So Billie, I'm going to ask you a couple of great questions that are coming in from the audience, very practical and applied questions. So firstly, we've got one here saying, firstly, massive fan of your work. So thank you so much for the presentation. And she says, I work in a regional council in Queensland, and I'm seeking to have your indicators adopted via our new urban design framework, which will be linked to our planning scheme. We have an urban centre.
That makes my heart sing to hear that. Thanks for your question. Thanks for telling us.
We have an urban centre and a number of smaller townships or satellite sites. I'm confident that your indicators would be applicable to our major urban centre, but would your indicators also be appropriate for use in the urban centres of these little regional townships? So could you comment a bit about that?
Yeah, I think what we've done is the indicators have been designed for cities, or cities, and cities can be small, or townships, but not necessary for regional community or rural communities. And so you need to be careful in their application, because you wouldn't expect everyone to have all these amenities within a close distance in a rural town. And I guess it depends on the size of the place. Melanie Davin actually did some work with through Clean Air and Urban Landscape. They funded us to look at livability indicators for regional communities, and she found that there was a lot of consistency with what we, the sorts of things that we talked about: access to schools, access to shops and services, being able to walk places, having cycling infrastructure. These were all very important, but there were other things that were important which weren't around the built form. Access to gambling, which is a detrimental, negative impact on people's health. There were other indicators that were important. So yes and no, and I think it depends on the size of the community, because you couldn't expect everything to be as close as what you'd expect in a a bigger city. But I think that the concept of it, and in some ways it's the sort of thing that needs to be explored based on the size of the place that we're talking about. But I think the indicators have been designed now or developed now for the 21 cities, which is where 80% of the people in Australia live. In those, now whether the smaller villages or towns outside of those, I'm not sure. We'd have to. It's a sort of a research question in a way.
A new partner potentially, Billie.
A new partner.
I'm going to ask one more very simple, well, it's actually a very complex answer, but a simple question, and then I'll hand over back to you, Mel, to ask either something from the audience or another one of your own. So there's one here that says, who would you focus on if you're advocating for lower speed limits? The Minister for Transport, Education regarding school travel, or Health? The Minister for Health. Which minister, I guess they're saying? Who would you lobby?
Well, I would get the community to start jumping up and down about it. You know, ministers respond to what it's probably going to come from transport, local government. I mean, I would be focusing on local government. Yeah, it's an interesting one but it's really, you've got to create a movement for that sort of change. And it's often that it's through the community and being in the media. I mean, I remember, this is not a very good answer, but it depends where you are. But when I was in Perth, there was the Australian Council on Smoking and Health, and what they used to do was they had like a writing group, and then when something came up in the media, they would then have people who'd write letters to the editor. And now that was way back when. What's the equivalent? That's probably something on Twitter and Twitter and using social media that gets attention now. And we need to think about these innovative ways of involving the community. So it's not just one group that's advocating, it's a coalition. So creating a coalition of different groups that can actually advocate it. So it's not just one, it's a multiple groups, and certainly involving the community. I mean, I think what usually happens is that ministers do what the community want, and I think transport probably would be the one. You could try health, but health often gets so waylaid with disease, illness, that the prevention tends to be a little lost. So we need more ministers of health, and we need a minister of illness, in my opinion.
Back to you, Mel. Oh, we can't hear you, Mel, at the moment. You might be on mute.
I think I just unmuted myself.
Great, yes.
We've got a question from the audience that actually resonates with my personal question as well. So the question is about what personal attributes, or we can call it leadership quality, do you think is needed, or that's the one that you use to bring so many players together? Because I'm always fascinated by your team, Billie, and you've got such a lovely team, either locally or remotely in Australia and around the world. So how do you do that? And do you have any tips for building teams and keeping the team performing and doing their best?
Yeah, I think, our team is a very multidisciplinary team. We have people with all sorts of backgrounds. There's the health, people with public health backgrounds in our team is the smaller part of the team. So we have computer scientists, we have geospatial scientists, we've had psychologists, we've had sports scientists, we've had ecologists, environmental health people. We've got people with planning backgrounds, we've got people with transport backgrounds, we've got people with all sorts of backgrounds. And I think the strength of that is that, my way of doing this sort of interdisciplinary research, or transdisciplinary as people call it now, especially when you involve policymakers, is to focus on the problem that you're trying to solve. So this is the problem that we're trying to solve. And not everyone's cut out for this, because everyone speaks different languages, and they just want to stay within their discipline. But we've actually had a really great group which are willing to focus on the problems. What's the problem we're trying to solve here? And how can we use the best of computer science, geospatial science, public health research to focus on the problems? And I think what's really critical is to really respect the expertise of the other people in the team, to really be open, to be, have real integrity of listening to the others and try and, even though, technical people can know how to count, but a qualitative person is really important because they're going to give you the insights about, what the community thinks of this or how to make this important and relevant to policymakers. Having someone who's got a policy background that can go and understand the policies. And that's why, it's always tragic to me when anyone leads a team, because they hold such an important part of the puzzle. And, generally, people who do leave the team, we maintain the relationship when they work where they've gone to. We try and stay connected because they have such an important part to play in the group. So I think the main thing is really focusing on the problems that you're trying to solve as a group. I think it's really important these days, that always it's been, but in particular now, to see how you can collaborate. We do team writing now. We're starting to do team writing so that it's not just one person writing a paper, but we do team writing to try and improve our productivity. And then, putting all that expertise together is really the key to success, I think. But collaboration is really the answer. If you want to be a professor, if you want to be successful, the key to success is collaboration, because you can't do all this by yourself, as you can see with all of our work. And it's collaboration with people outside of the academy as well as people who are researchers across the globe.
So, Billie, just this is sort of building on what you've been talking about already, but what do you think are some of the main challenges of working across sectors, and how do you find the right language? I mean, you've said focus on the problem. So you're jointly solving problems. Are there any other things that you could reflect in terms of how you find the right words, how the right language to communicate, and to work across these disciplines and more importantly, across sectors?
Yeah, I mean, it's really interesting. Like, I never used to talk about physical activity, for example. I don't go and talk to the Secretary of Transport about physical activity. The Minister for Transport is not interested in physical activity. Minister for Transport is interested in how can actual transport or walking and cycling contribute to reducing congestion. He's trying to manage growth. He's trying to manage all these other sort of big issues. Now it's we've got a female now, but in the past it was a male. So I think it's really using the language. I think it's really important to use, if you want to work with another sector, you have to understand the language of the sector, not stay within health. And in many ways, it's hard for me to speak to people in health now because I speak mainly to people outside the health sector, and so it's quite difficult. But I think it's really, if you want to work with those groups, then it's really important to speak to them in the language that's, especially in the beginning. I do find it interesting now, though, having said that, is that I do find that a lot of people outside the health sector are talking health. They talk health, and they say, "Oh, this will affect obesity." And I'm always staggered now. I think, my job's done. People who are outside of the health sector are talking health back to me, and I think that's a really good sign. But I think importantly is start where other people are at, and really try and understand the problem from their point of view. Is really, really, to me, the most fundamental lesson that I could offer you, is that that's really the key to success in terms of doing this work, because you can't assume that everyone's going to be interested in health. I've never taken that view, but they do want to solve the problems, and so because of the co-benefits, by them getting what they want done, will actually produce a co-benefit for me in health. So I don't need to focus on my health problem. I just need to help them achieve for them to be successful. If they're successful, I'm going to be successful, if you understand what I mean. So that's really been the focus of my approach to dealing with sectors outside of health.
Wise advice. Thank you. Mel, over to you.
Yeah, so Billie, earlier in your presentation, you talked about how you found the opportunity of, using the concept of livability as a way to implement some of your vision for research, because Melbourne, as we have all heard about, as one of the most livable cities in the world, and you think that that's a concept that's very receptive to policymakers in Melbourne. So that really requires, I think that's very clever, that really requires a very good sense for the policy and political environment that you're in. So, again, this is a question on behalf of researchers, particularly those in early and mid-career. So how do we develop that sense, in addition to listening to community that you have mentioned about, but how do we craft our research ideas or package our research ideas in a way that is timely and to use not so nice word, popular at the moment.
Yeah, I mean, I think that's a really good point, because I mean, I don't know that I did that to be super clever. I just wanted to have cut through. And it was interesting. I guess the one question I'll come back to is listening, though, because Ian Butterworth was very kind in funding me to go around and do these interviews, because he wanted to work out how to get all these sectors to promote the health and wellbeing plan. And when I sat and listened to them, I mean, I could have sat and said, no, I want you to promote health. I want you to run a smoking class, or I want you to do physical activity program. But I just listened to them about what they were saying. And they were saying things like, well, the things that are affecting the health of people here are, you know, there's no public transport here. And there's no jobs. People have to travel for 2 or 3 hours to get to jobs. And they can't walk anywhere. They have to drive. There's not enough public open space. Now, if you're on top of the literature around the social determinants of health, for example, they are social determinants of health. We make decisions about the way we build cities, and that is a social determinant of health. So I guess knowing your fields, you know, knowing that, like, for example, just to give you a sense of what I mean, last year in 2020, the WHO promoted a report on climate change and health, and they've also done one on biodiversity. Now, these you wouldn't, well, obviously now we do know much more about health and climate change. These reports are really important to get on top of them, understand them, read them, really dig into them. And then when you're doing your research, tying your ideas to, I'm a sort of big picture person, everyone on the team, I drive everyone crazy because I'm the big picture person and everyone else has to make, you know, things happen. I'm not the detail person. And, you know, and in a way I'm sort of doing myself out of a job because everyone else does all the work now, and I don't, and I, you know, you have to ask yourself, what do I contribute? But I am a big picture person, and I do read these bigger reports and then see, and then when I'm looking at what the issues are locally, which you know go from global to local, it's sort of, you can start to tie these agendas together, which is really what happened with the livability. It was a, you know, the big issues, you know, around the social determinants of health in 2008. There was the WHO Commission on the Social Determinants of Health, and you know how we could close the gap, and it talked about toxic policies contributing to the inequalities that we see in health. And so, and they talked about some of these, you know, these things like transport. So how do you go from that big health idea, and then you're listening to all these local government authorities and regional health, regional government people talking about what really are social determinants of health? And as I say, if I just stuck to social determinants of health, I knew I wasn't going to have any sway. But I knew that every report, every time we had 7 years of Melbourne becoming the most livable city of the world, these are the sorts of things that are about livability. So the beauty of what we did, I think, was it's a value that people have here in Victoria, that, you know, that places are livable. What we were able to show is that, yeah, but livable for who? If you live in inner Melbourne, it's very livable. But what we were able to show is there's a real inequity or inequality in the way we're building our cities, that the people in the centre get everything and the people on the fringe not getting anything. So in terms of the social determinants of health, it was really quite clear to me, especially after we did the research. So I suppose what I'm saying is that it's really understanding these big picture ideas from these big global agencies, and then tying it to your local agenda, and then knowing what's going on locally. You know, like Sydney, for example, you know, has a big focus on the 30-minute city now. We have a focus on the 20-minute neighbourhood. So I've tied my research to the 20-minute neighbourhood. In fact, I've got some studies that I'm trying to do is work out how can you combine the two concepts. These are social determinants of health. So you can sort of see the streams of the big picture global ideas to the local policy ideas, but you have to be on top of what's going on locally to know that. You need to be attuned. You need to be reading, turning up to talks that people do. You know, it all takes time. I know it's busy, and actually the other thing, I think when I first started out, you know, I've grown up with people. I've grown up. Well, I was just talking to Carmen Williams, who's involved with the Prevention Centre in South Australia. We've known each other since 1987 or something, and we've grown up together. And she's been a policymaker, I've been a researcher, but our paths have crossed all the time. And I think that's the thing. We weren't senior people when we started. We are senior people now, and we've grown up together, and we fire off each other in terms of ideas. So, you know, you can create great relationships. It used to be a job that the, you know, places like the Public Health Association used to meet policymakers and as well, and your people who are practitioners as well as researchers getting together. And I think what government departments could do is facilitate those opportunities in the same way that Ian facilitated me getting to speak to all these people. I think we need a mechanism that facilitates these relationships being formed so that you can form over time. It's sort of friendships, professional friendships, and you hear about things. That's really how I've developed my career. I don't know, that's a long answer.
Thank you for sharing that, Billie. So I take notes for making friends and really listen. And if you don't mind me reflecting, I just thought that because earlier there was an audience who asked questions about the quality attributes that were involved in your, you know, success story. And one thing I'm really hearing is your ability to listen. And just yesterday, coincidentally, I was listening to a podcast about, you know, workplace listening and people's, and they were talking about how most people walk around in our work life either as a persecutor or a preacher. So our mind is already set up. So I'm either against everything you say because I'm all about health, or just using your example, or
I'm the preacher.
You know, yeah, exactly. But what we really need is a mindset of a politician, because I'm trying to get votes to put my agenda forward. So at least I'll try to pretend that I'm listening, but in fact, what we really need is this curiosity that I really see you demonstrating with so many of your answers, that you really listen mindfully and with a lot of caring for the issues at hand. So I think that's, to me and to a lot of audience here, I guess one of your secrets of success.
Yeah, I mean, I think it's really, I really do like to know what's going on. Like, that's when you're working with policymakers, and I really like to know. I mean, knowing, respecting what they know, people know, you know, like you can just learn so much. As I say, a lot of what I've learned around cities has come from my relationships, and people whip me into shape. They're really quite rude to me sometimes. They give me a hard time, but you know, I learn a lot from them because, you know, they think I'm a, you know, well, I think they do respect me as an academic, but you know, as an academic, you can be a little bit wet behind the ears, and it's really important to know that you're a bit naive, I think, and that's what I've come to appreciate, is the practicalities of what they're trying to do is really hard. And I guess what I've tried to do is, well, okay, here are your problems. What can I do to try and solve those problems for you or help you with those problems? And then getting them input along the way. That's why I think it's been picked up, because they are, what I've learned from the really good guys that I work with, and good guys being women and men, is they're really trying to make a difference. And then what can I do to help them do that? Because I want to have health at the back of my, I say I'm, you know, unapologetic that the underlying value of my work is around health and well-being and equity. And so then how can I help people achieve what they want to achieve when they're aligned with what I want to achieve? And how can I help them? That's really like the underlying principle. It's really like selfish in a way. You know, I want to achieve what I want to achieve. I haven't got a lot of time. How can I fast track that and work with them? So I guess if you want to make change to the world, as I've always wanted to do, and in a positive way, then the pathway to doing that is to listen and to design, create your research so that it's relevant to the people that you're trying to influence.
I think a very strong theme that's coming through is the importance of relationships, and you've put a lot of emphasis in that in your talks. And I think those long-standing, trusting, open relationships where people can bounce ideas off each other clearly are very important to you. But as you say, it really takes time. And I think we need to explicitly recognize that it does take time, and it's not a waste of time, that it's actually a really valuable investment.
I think that's why I put it as the last point for funders, if there are any funders. It is time consuming. And I don't think we should just, make it a research translation grant that you get. That's another lot of work to do that. In every grant, we should have enough capacity to be able to do some of this along the way, because it's not a separate thing. We shouldn't expect everyone to do it after they finish their grant. It's actually something you have to do along the way. And that's the other thing, I suppose, in terms of the key lesson here, is don't wait to the end, say, oh, we've done this research, now we want to translate it. I don't work like that. It's really getting feedback along the way and working with people. When you're designing the research, getting their input, co-designing it with people, saying what would make this more relevant. That's what we did with our Australian Prevention Centre project on livability. We got policymakers in the room at the beginning and said, what's going to make this really fly? And they said, it's got to be policy relevant. He's got to speak to policy. That was really good advice, because we were on that line anyway, but it just reinforced it. So we actually went down to policy. We had to pivot a little bit with our research, because we actually had to go and delay what we planned to do, so we could actually do policy analysis in the various states to be able to accommodate that direction that they specified. But I think the proof is in the pudding, really, because I think because we did that, it made it so much more relevant to so many more people. So yeah, I think listening and the relationships are really critical.
I've got another question here from the audience saying, have you seen any successes in improving the poorly planned areas that are on the outer edges of cities? Anything that you could share there?
I think the thing is that people are really trying now. I think I'm really excited to see that in Perth now they've got a policy that people should be drilling at 26 dwellings per hectare. In Western Australia, it was very exciting, because one of the people, the way I developed my relationship with people at the Department of Planning was that when I was doing my PhD, I needed to get some data, and they had data that I thought I could use. So I went in with my PhD supervisor, actually, and we went in to see them. And my PhD supervisor said to this very executive in planning, you may not realise this, but really you're a health organisation, that you will do more to promote health than what we can do in the Department of Health. And the guy sort of was a bit shocked, but it makes sense. And I think that was something that always stuck in my mind as a really good lesson, the message to give to policymakers. But what happened was that when I finished my PhD, and because I had the data, I went back to show them the results. And when I went back, that person had left, but I met Evan Jones, who has been a long-term collaborator ever since. And I went back to show him. He was so excited when he saw the results of our research. Because they were developing this new, the Healthy Livable Cities, the Livable Development Guidelines, which were based on new urbanism principles. And he got very excited to see the research. He said, oh, your research is actually speaking to what we're trying to do here with these livable neighbourhood guidelines. And as a result of those conversations and the long-term relationship we developed, we ended up evaluating the livable neighbourhood guidelines. So I think the idea that you can, that by working with people, by actually hearing these things is really critical.
Mel, anything from you or from the audience? Actually, while you're very hard. No, you go for it.
Am I allowed to ask hard questions that I don't know. Well, I will ask that anyway. So because I've been taking so many notes while Billie was speaking, and it's just really, it's very compelling for me to see you embodying leadership in such an elegant way that it's about a bigger good. It's about what you want to achieve, what impact you want to make. It's about your vision. It's about your passion. It's not about you. And I think that's so important because when we're trapped in our ego, it's less likely that we take advice from other people. It's less likely that we're really listen to people, for example. And I think that's really beautiful. On top of that, we talked about the environment, the research environment today being different from, as you mentioned, Billie, when you just finished your PhD. And I think that is something that a lot of us early mid-career researchers really see as a challenge, because these days we have so much pressure in terms of, what's your HEX, how many publications, how many citations do you have? I'm now in the middle of investigator grant application, so I know all about that. In an ideal world, I really want to park all of this ego aspects aside so that I can focus on creating positive changes to the environment, to the society. So how do we navigate this? First, as individuals, individual researchers, and second, how do we advocate for changing the way we evaluate research and we provide funding?
I know, I really hear you, Melody. I think it's really a big challenge. As I said, I had one publication at the end of my PhD in the Health Revision Journal of Australia, a qualitative paper, and then I didn't publish anything for a number of years because I went off and set up the university campus on the south coast of Western Australia. So, I didn't, I don't know how I got a career development award. I really don't know how that happened, because I was just really fortunate, and there weren't as many, I didn't have as much competition in those days. And I did have a good idea. I think at the end of the day, my advice for anyone is just to focus on the ideas. The only way you'll be really successful, the only way you'll have a high impact publication is good ideas. That's the thing. Everything that I did, everything was pretty, I was one of the first to do a lot of things. And it's very hard to do a lot of things, be the first. That takes time. So you have to develop the methods and all that sort of stuff. But once it's, takes off, and it took a long time. Actually, I'll tell you this too, because my first paper, it got rejected. This is my most highly cited paper from my PhD. It got rejected by Social Science and Medicine. And I had the courage. I don't know. I amazed myself really that I did it. But I wrote back to the editor and I said, I think you've had this reviewed by geography reviewers. I think if you sent this to a public health reviewer, they would review it very differently. This is very innovative in public health. It may not be in geography, because I used an old method from geography from 1959, gravity models. And so I wrote back and said, can you please go back to a social science, can you go back to a public health? And they did, and it's my most highly cited paper. Now, what I'm saying to you is that you are under a lot more pressure now. There's no question of that. But I think the secret to success still is good ideas, really good ideas, innovation. And actually the beauty of doing this collaboration with people outside of your field is this idea that you can take a method that's well established in another area, as my example of the gravity models, well established in geography. But I applied it in public health, and it's my most highly cited paper. How can you have good ideas where you collaborate with someone in another field and bring their good ideas to your field, to health? And I think the focus should be on good ideas. You can't guarantee whether you're going to have a highly cited paper. Who knows if it's going to be? But if it's a good idea, if it's innovative, it's the pathway to success. Being on trend, like knowing what's going on is really important as well, of course.
Talking of being on trend, there's another topic I think it would be really interesting to hear you talk a bit about, is the intersection between, and I know it's something that's very close to your heart as well, between sustainability and livability. So environmental sustainability, and I know you've done some great work recently in that area, and we've had a couple of questions from the audience as well around adopting, say, tree canopies as an indicator of livability, healthy, livable communities. So could you comment on that?
Yeah, I think that's really critical. We had, when we defined livability, we had environmental sustainability as a part of it. So we said that a livable community was safe and socially cohesive and inclusive. It was environmentally sustainable. It has to be environmentally sustainable, and it has housing. So we actually, in the end, that's one domain in our livability work that we haven't really fully exploited. There's so much you can do in a, with a program of work, and we were looking at chronic disease. I think the time has come that we're, well overdue to create indicators which are broader. It's interesting, actually, Thomas Astelbert talking about innovation and doing creative things. He's just published a series of papers with Zhao-Chi Feng on tree canopy and he's used the 45 Up study in New South Wales on tree canopy and diabetes, hypertension, cardiovascular disease, and dementia, and found that where there is 30% or more tree canopy, you get lower risk of disease. Now, we don't know fully the mechanisms for that, but that is very powerful. And I noticed that he's got a lot of citations out of those papers. And that's what I mean, Melody, is, working with people who can help you if you want to do something exciting. Like, I don't regard myself as I'm not going to be able to do the geospatial, but I knew what I wanted to measure. And so I did it. I worked with people who could help me do the measurement. And it was a collaboration. And over the years, I've had many, many people working who are the spatial scientists that I've worked with. So I guess that's to be high impact, you've got to bring innovation to it, and partly innovation can come from your collaborations with other sectors using well-established methods, or even I think we've actually changed geography. Actually, the way we've done our work on livability over the years, we've actually changed them because we've used it in a different way. I was one of the first people in public health to use geospatial data the way we've done it. The creation of indicators was something that we came up with afterwards. Policy relevance came later. So, I think it's really important to work with other people who can actually help you with that using established methods from other fields. And actually incredibly important to now, that's what this climate change report was about from WHO last year in 2020. They published a report talking about the need to bring together chronic disease with climate change agendas. Creating, healthy and sustainable lifestyles is something that's been pushed a lot through the climate change commissions from Lancet. And so I think we need to be thinking along those lines about, bringing these agendas together, and critically important. So yeah, I totally agree that we need that domain of, in fact, I've done a lit review with some TAPS funding. We've done a lit review on looking at what those indicators could be. So we've got a candidate that could go into the observatory.
Fantastic.
Thank you, Billie. Could I read out one comment to Billie? I just thought that it's a really good, possibly this could be our last opportunity for comment, right, Lucy? So his comment reads, I agree with Mel, the academic research world for women is getting more and more difficult to negotiate and carve out the place in the research world. I congratulate Billie for her honesty and continued support by ECRs and her past students. She always gives back. Thank you, Billie.
That's lovely. I was going to read that one too.
Make me cry.
We do have a few minutes left, Billie. But there's just one other question that, if you could quickly comment. Do you know, in addition to sort of planning ahead, planning policies, is anyone using livability to retrofit or improve existing developments or existing communities?
Well, I'm hoping that they are. I mean, it was really interesting hearing, from someone up in Queensland wanting to use the indicators in regional communities. We don't really know exactly I don't really know now because Melanie Davin's running the Australian Urban Observatory, so I don't hear a lot of the way the data's being used. But the whole idea of the livability, so with the Australian Urban Observatory, what we've done is we've designed it so that for free you can get indicators at the local government area level, but at sub-LGA level, which requires a subscription or some partnering to resourcing, which is not very expensive, about $7,000 for a local government area. You can see the sub-LGA, what's going on the ground. And the whole idea of that is to see whether or not we can get the able to start to retrofit existing areas. There is a little bit of work being done by the 20-minute neighbourhood people here in Melbourne, so the Department of Environment, Land, Water and Planning. They're doing the 20-minute neighbourhood and working with local councils to see how they could retrofit communities. And they had said, as I showed you in my brag bag of opportunity, they had talked about the indicators being one of the potential frameworks that they could use. It's harder to retrofit areas than it is to build them right in the first place. That's the problem. I mean, that's why it's so critical that we get it right. We still build a lot of houses every year, and I think there's an opportunity to really get it right in the first place. If you don't get the foundation right, it's really hard to retrofit. So I guess, but the indicators are there for local governments to be able, in established areas, to look at, well, what could they do to improve the livability of their cities? So yes, I think they are, and that's why, that's what local government has been buying the access to the sub-LGA indicators to be able to use that to see how they can improve their communities and to identify inequities, inequalities in a local government area, and so they can see where they need to intervene.
And even if you can't do it all, you can find some opportunities that are affordable and feasible. So it's great that it's being used in both ways. I think we are running out of time, so I've got the terrible task of bringing this to an end, because I think we could sit and chat for another 2 hours. It's been an absolute pleasure, Billie. So I really want to thank you for inspiring so many of us with your passion and commitment to prevention, your wisdom, and all the wonderful lessons that you've shared with us today. It's been really wonderful, so thank you. Thanks also to you, Melody, for joining the conversation and sharing through your questions, your enthusiasm and knowledge about prevention and your passion about this work. And it's been wonderful to have you join us as well. I also want to thank the team here at the Coordinating Centre, and particularly Karen Metcalf from the Sachs Institute, who did such a great job of preparing and coordinating the logistics for this event. And apologise for the outage that we had in the middle, but I'm sure we can fix that up in the recordings. And thank you to all of you for joining us today, who are watching live or who are listening to the recordings. It's a real pleasure, and your interest in the work of the Centre and of Billie's work is wonderful. Just to let you know that we will share the final recordings and the slides with all our registered participants, and you'll also be able to find them, the resources on your website. So if you want to share them with your colleagues, you'll be able to do that. And also a plug for our newsletter. So all of the work of the Prevention Centre, news about and events and other stories about prevention are communicated through the Chronicle newsletter, which is going to become monthly. So if you haven't yet subscribed, please visit our website and sign up. So just with that, thank you so much again, Billie and Melody, and thank you all for joining us. And for now, until next time, the next Prevention Works Live, we'll say goodbye.
Okay. Thank you, everyone. Bye.
Bye.
Thank you.